Bismillahirrahmanirrahim. The quote of the day is: be aware of your own worth, use all of your power to achieve it, create an ocean from a dewdrop, do not beg for light from the moon, obtain it from the spark within you. A quote by our national poet Muhammad Iqbal. Today, the topic of presentation is dog bite under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is epidemiology of dog bites, causes of dog bites, health effects of dog bites, management of dog bite, prevention of dog bites, measures taken to reduce dog bites, infections caused by dog bites, recent updates, and MCQs. By the end of this presentation, participants will be able to describe what are the health effects of dog bites on humans, tips to prevent dog bites, first aid and management of dog bite wounds, what different infections can be caused by dog bites and their management, immunization of dogs, what public health measures can be taken to reduce dog population and rabies incidence. No dog bite. A dog bite is a bite upon a person or other animal by a dog, including from a rabid dog. Though some dog bites do not result in injury, they can result in infection, disfigurement, temporary or permanent disability, or death. A dog attack is mm, uh, when dog bites again after the initial bite, and soft bite is that bite when the dog bites while playing. And dog bites can occur during dog fighting as a response to mistreatment, trained dog working as guard, police, or military animals, or during a random encounter. Epidemiology of dog bites. Dog bites account for up to 90% of all animal bites. Significant dog bites affect tens of millions of people globally every year. It is estimated that 2% of USA population, about 4.5 to 4.7 million people, are bitten by dogs each year. Between 2005 and 2018, approximately 471 people were killed by dog bites in the United States, averaging about 37 deaths each year. Animal bites, most of which are from dogs, are the reason for 1% of visits to emergency departments in the USA, and more than 27,000 victims require reconstructive surgery. Children between the ages of 5 to 9 years are more likely to be bitten by a dog. Children are also more likely to need medical attention. Now, the health effects of dog bites. There are three important issues that are associated with the dog bite, that are skin damage that may result in abrasions, scratches, and if the wound is not managed properly, it results in scarring, injury. Dogs have rounded teeth, and it is the pressure exerted by their jaws that can cause significant damage to the tissues under the skin, including bones, muscles, tendons, blood vessels, and nerves. It can also lead to infection. Dog bites inoculate bacteria deep into tissue. The majority of dog bites get infected. Common bacteria involved in such infections including streptococci, staphylococcus including methicillin-resistant Staphylococcus aureus, Capnocytophaga canimorsus, um, Bargella zool- zolecum that leads to bacteriemia, Pasteurella, tetanus, and rabies. It can also lead to death. The number of deaths due to dog bites in the United States annually is very low. When they occur, about 70% of deaths related to dog bites that happen to children younger than 10 years of age. Know why dog bites. Breeds. All dog breeds can inflict a bite. Breed is not an accurate predictor of whether or not a dog will bite. In the USA, Pit Bull type and Rottweilers are most frequently identified breeds in cases of severe bites, and they are involved in more than half of the deaths. Dog behavior. Those dog behavior that have predatory behaviors and pack kill instinct have more chances to bite, and they will bite in this stressful situation when they are scared or startled, when they are threatened, or when they are protecting something like their kids or food, and when they are not feeling well or when they are playing. No aspects of dog behavior which influence dog bite preventive measures. Dogs sniff as means of communication. Dogs like to chase moving objects. Dogs run faster than humans. Screaming may incite predatory behavior. That eye contact may be interpreted as aggression. Lying on ground provokes attack. Dog tends to attack extremities like face and neck. Dogs which are fighting tend to bite at anything else that is near. Know how to prevent dog bites. Dog bites can be prevented by socializing your dog, for example, by familiarizing your dog with your family members, and being a responsible pet owner, educating your family how to treat with the dog, avoiding risky situations, for example when the dog is eating or feeding their puppies, and paying attention to body language of the dogs, and read on to learn the steps you should take following a dog bite and what you can do to prevent infection. Now, these are the 10 tips to prevent dog bites. Do not approach an unfamiliar dog. Do not run from a dog and scream. Do not approach a dog. Do not approach a dog which with quick motions are from above their head. Choose a dog breed that is compatible with family. Do not pet an aggressive dog and without allowing it to see and sniff you first. Remain motionless, for example, be still like a tree when approached by an unfamiliar dog. If knocked over by a dog, roll into a ball and lie still, for example, by be still like a log. Avoid direct eye contact with the dog. Do not disturb a dog who is sleeping, eating, or carrying their puppies. Do not hug or kiss a dog. Immediately report stray dogs or dogs displaying unusual behaviors. Know what to do if dog bites. Go to safe place away from the dog to avoid from the next bite. Infants and children should be evaluated. If there is a small amount of abrasion from dog bite, it may be reasonable to watch for signs and symptoms of infection. Wounds should be kept elevated, and if it is possible, you may attempt to clean the dog bite with tap water. In some instances, you will be able to administer first aid to yourself. Gather information from the dog's owner about the dog's rabies immunization status. Since dog bite can cause significant damage beneath the skin, so attention should be given to the wound. Administering first aid for dog bite. How to administer the first aid after the dog bite. The type of first aid you will administer will be determined by the severity of the bite. First of all, wash the wound with soap and warm water. If your skin was broken, gently press on the wound to promote a small amount of bleeding. This will help to flush out germs. If the bite is already bleeding, apply a clean cloth to wound and gently press down to stop the flow. Follow with the application of antibacterial lotion and cover with a sterile bandage. All dog bite wounds, even minor ones, should be monitored for signs of infection until they are completely healed. Seek help if you suspect infection or possible exposure to rabies or if the wound is severe. No dog bite management. There are three important treatment issues that need to be addressed with the dog bite. That is skin damage that leads to abrasion, scratches, and may lead to scarring, and injury to underlying tissues such as muscle, nerves, and bone, and infections. No dog bites. There is increased infection risk if the age is below 2 years and greater than 50 years, and those persons who are having diabetes are immunosuppressed, patients consuming chronic alcoholism, or they have puncture wounds, or large wounds, or the wounds on the extremities, or when they present later after the dog bite. Know how to prevent infection. Dog bites can introduce dangerous bacteria into the body. This can cause serious and sometimes fatal infections to occur when they left untreated. It is very important to wash the wound as soon as you are bitten and to use topical antibiotics such as povidone iodine in and around the broken skin. Keep the wound covered and change bandages daily. Keep an eye on the wound for signs of infection. Depending on the type of infection, symptoms can start appearing within 24 hours up to 14 days after being bitten. Infections can spread quickly throughout the body. Take antibiotics if prescribed by a doctor. Now, how can you tell if a dog bite is infected? Symptoms of dog bite infection can include swelling and redness around the wound, pain that lasts longer than 24 hours, drainage from the wound, difficulty moving the affected part of the body, a warm feeling around the wound. Now, these are the signs that the infection may have spread to other parts of the body that include fever, shaking, and night sweats. Now, when to seek help? Around in 1 in 5 dog bites require medical treatment. Always see a doctor for a dog bite that is caused by a dog with an unknown rabies vaccine history, or by a dog that is acting erratically or appears to be sick, or the wound doesn't stop bleeding, or it causes intense pain, or it exposes bone, tendons, or muscles, or it causes loss of function such as inability to bend fingers, or when it looks red, swollen, or inflamed, or when there is pus or fluid leaking from the wound. Also seek medical attention if you do not remember when you had your last tetanus shot, when you feel weak, disoriented, or faint, or you uh, suffering from a fever. No dog bites. Criteria for hospital admission. Admit to the hospital if the patient presents with deep established infection, possible penetration of joint capsule, or when surgical repair is required, such as tooth penetration of or dura, or the dog bites associated with fractures. Now, the management of dog bite wounds in hospitals. Take a history of events when a dog bites. Examine the patient. Most dog bites can be cared for in the emergency department. Whether any deep structures like muscle, tendon, nerve, or bone have been damaged, commonly the wound is anesthetized so that it can be explored. This will help confirm the condition of the deep structures and their function. The wound will then be washed with normal saline to irrigate out as much dirt and bacteria as possible. Once the wound has been cleaned, a decision needs to be made whether to close the skin or not. Stitching the skin increases the risk of infection. Balancing the risk of infection against the benefit of a better looking scar depends upon the location of the injury and the discussion between the doctor and the patient. Dog bites to the face tend to be sutured, while those located on less noticeable parts of the body may be left to heal on their own. Sometimes dog bite wounds need surgery to repair the wound if there is considerable skin damage or skin loss, or if they are associated with injuries that need treatment. There is some controversy regarding antibiotic therapy for dog bites. Now, this is a picture of a child victim who is bitten by a dog on his face, and there there is a approximately 3 into 4 centimeter large wound, and and then the wound is sutured to for better cosmetic appearance of the patient. Now, this is the rules for prophylactic antibiotics of dog bites. Some studies have found prophylaxis is not indicated. However, some studies advise prophylaxis for hand, foot, and delayed presentation bites. Also consider antibiotic treatment for very live bites that require sutures, and if any question of tooth penetration into the periosteum. It is clearly not needed for simple shallow bites of the face or skull. Now, this is the best prophylactic antibiotic for dog bites, and the antibiotics that need to be covered first of 4 years are dicloxacillin or cephalexin 500 mg per oral 4 times daily for 7 days. Erythromycin or azithromycin if patient is allergic to the penicillins, or penicillin VK 500 mg PO 4 times daily for 7 days if the infection is with Pasteurella. Uh, Amoxicillin and clavulant, that is augmentin, often touted as antibiotic of choice for bites, but there is zero literature evidence for this. It is expensive and has high percentage of side effects. Also, in one study from 1994, the only empiric failures were in those given augmentin. No considerations about radiographs for dog bite cases. Live dogs can generate forces greater than 500 foot-pound per square inch with their jaws, therefore can cause extremity long bone fractures. Also can cause dural penetration from skull bites in small children. This can lead to fatal meningitis if missed in the emergency department. So skull films may be needed to see if there is inner table penetration from teeth. Now the dog immunization stations. Find out if the dog that bite you has current rabies immunization. If the dog has not been immunized for rabies, the question becomes whether to immunize the patient against the rabies virus. Bear in mind that the dog would have to be euthanized and their brain tested for rabies. A variety of approaches may be considered depending upon the situation surrounding the bite. Is the dog available to be observed? Was the bite provoked or defensive rather than an unprovoked attack? Or where is the bite located? Or what is the past medical history of the victim? Do you need a rabies vaccine? If you are bitten by a dog that shows signs of rabies, such as acting erratically or foaming at the mouth, you should get a rabies vaccine. Rabies is potentially fatal condition which is 100% preventable when immediate medical treatment is received. If you or your doctor have any concerns that you might have contracted rabies through a dog bite, getting a rabies post-exposure vaccine makes sense. The vaccine is given as a series of 4 injections over the course of several weeks. An additional injection of rabies immunoglobulin is also required as parts of treatment. Now the tetanus immunization. According to American Academy of Pediatrics, people with dirty wound would have a booster tetanus vaccine if more than 5 years have been passed since their last tetanus shot, And for a clean wound, people would have a booster vaccine if it has been more than 10 years since their last tetanus shot. Now, will the dog bite victim will get rabies? Rabies immunization status of the dog must be determined immediately. Rabies therapy, if necessary, must begin as soon as possible. The victim's tetanus status also needs to be current. Exposure to a rabid animal does not always result in rabies. If treatment is initiated promptly following a rabies exposure, rabies can be prevented. If rabies exposure is not treated and a person develops clinical signs of rabies, the disease usually results in death. Now, these are the different bacteria that are isolated from dog bite wounds. Over 50 genesis have been reported. Most common among them are Staph aureus, Staph epidermidis, Streptococcus aureus, and other anaerobes, and less common are like Pasteurella, Brucella, and Neisseria species. Know the infections that are caused by the dog bites. First infection that we will discuss is Capnocytophaga pneumorosus. It is a normal bacteria that is commonly found in the mouths of dogs and cats. It is transmitted to humans by animal bites. The symptoms can appear between 1 to 2 weeks after dog bite. The symptoms include blistering around the wound as shown in the figures, redness, swelling and pain around the wound, oozing from the wound, fever, vomiting, diarrhea, headaches and joint pain. Without treatment, complications